मुश्किलें इंसान का हौसला आजमाती हैं, सपनों का पर्दा निगाहों से हटाती हैं। गिर गया गिरकर संभल ए आदमी, ठोकरें इंसान को चलना सिखाती हैं, चलना सिखाती हैं। Hello dear friends, again very warm welcome to all of you at this beautiful conceptual brainstorming integrated session by Dr. Shrikant Verma at this amazing beautiful platform Cerebellum Academy. So today we are going to enter in the neuroanatomy, the radiology and the medicine integration. Also we will do integration with our ENT as well as we will integrate with the ophthalmology. How? We will see in this session. So before starting this session, few positive words for all of you. Don't limit yourself. No one else can define your limits except for you. So we are going to start this session. Yes, all the PDF, everything you will get within the our Cerebellum Academy app. Okay, beta? So try to understand. Yes. Can you see this image? Every time either your INI-CET or the NEET PG exam or the FMGE exam, you will see such kind of the cadaveric image, the anatomy image. Today, on the platform of this anatomy, I am going to integrate this topic with our radiology with a very funny way. We will see the basic principle of the radiology and then we will integrate the same image with the our radiology. Yes, I will show you the anatomy and then I will compare the same thing with our radiology. Too many facts about the medicine, ENT as well as our ophthalmology we are going to discuss. So hope you all are ready for this beautiful session. Okay, so let's start. Sir, whenever the cadaveric images are asked, I told you one thing. Our Rahat Indori Sahab told, yes, वो दिखाता है. Yes, you know that famous शायरी from the राहत इंदौरी साहब, वो बुलाती है मगर जाने का नहीं. Yes, you know the what is the other line? Yes, वो बुलाती है मगर जाने का नहीं, ये दुनिया है इधर आने का नहीं. मेरे बेटे तू इश्क कर, मेरे बेटे तू इश्क कर, लेकिन हद से गुजर जाने का नहीं. Just apply that शायरी over this our cadaveric image. Whenever they will show any cadaveric image, what is happening? At that time, we are getting the palpitation. We are getting the fear. Oh my God, I am looking this image for the first time. So there are the lots of the problem and we are getting sympathetic stimulation and yes, हड़बड़ी में गड़बड़ी हो जाती है. What you have to remember, the same lines from the राहत इंदौरी साहब, वो दिखाता है मगर देखने का नहीं. First you have to look the options, give direction to your thoughts, then you have to see up, down, medial, lateral. So this is the basic principle for the every cadaveric image. Hope you all are getting the point. Okay, yes, if you all are getting the point, just give me the thumbs up or any kind of the emojis. Okay, getting the point, everyone? Yes, so what I want to tell you, always you have to focus for the up, down, medial, lateral, then look for the our particular part. Again, I want to tell you, this session is very useful for the your first MBBS students, NEET PG, INI-CET, FMG students, USMLE plan, everyone. Okay, so we are going to integrate this beautiful topic. Okay, sir, fine. So this is our indicated part. Look up, above, down, medial, lateral. Then you have to say about this. They can put arrow over this part, any part. Okay. So one by one, give direction to your thoughts by looking over the option or in your practical exam. Look from your head to the toe. Okay. Now look here. Sir, this is our one part of the body. The option will say, sir, this is our head, neck, face area. Yes, this part is having the shape on the back side. So it is indicating, definitely anyone can say, yes, this portion is our nose. I am starting from the very silly point. If you are not aware about the anatomy, even you will taste this anatomy, you will feel this anatomy very easy. Okay, sir. If this is the nose, so can you tell me this is which side, sir? This is the anterior side and this is the posterior side. Agree, beta? Okay. Okay, sir. Now look here. So you can say the head area is located here. So the soft tissue covering, can you tell me the soft tissue covering over the cranial vault? I am putting A. Tell me what should be the name of this A? And then just below this soft tissue covering there is the one another structure. Can you observe this structure is from front to the back, and in the front side there is a one cavity within this bone. So can you tell me beta what is this B? Okay, and if you are able to say the B, then definitely you are able to identify this structure. Yes, this is the your usual pattern. Your practical viva question, they will mark, they will put the pointer and they will ask these things. So can you tell me what is the C? One by one. Yes, namaste Uday, namaste beta. So tell me the answer. Now, can you observe what is the part which is inside here, the C? Okay, one by one. I need answer from all of you, then I will describe. Okay, so tell me, very good, Uday, you are right, frontal sinus, but what? A, B, C, D. Yes, Shreya Krishna saying A is scalp. Shreya, you are right. A is our scalp. So just a few lines about the scalp. A scalp is nothing. It is a soft tissue covering over the cranial vault. हमारा जो दिमाग है, हमारा जो फेस है, हमारा जो cranial vault है, उसके ऊपर जो soft tissue covering है, that is the scalp. Okay, yes, I will teach you in the head neck face area the magic of 5 for the scalp. S for skin, C for connective tissue, A for aponeurosis, L for loose connective tissue, P for pericranium. The recent FMG question, remember, L for loose connective tissue, it is the dangerous area of the scalp. Yes, it is having no bony attachment on the front side, so blood is sweeping around the eyelid, which is resulting in the black eye. Also in clinical you will say the raccoon. This is the your question. Okay sir, got the point? So this entire portion is your what sir? This is a soft tissue covering known as the scalp. Okay, yes Chaitanya, Ram Shab. Okay, so what you have to remember, fine sir. B is nothing. B is our skull bone. Agree everyone? B is what sir? B is the skull bone. Now see, if this is the skull bone, then the front part is our frontal bone. So definitely, this C is our frontal air sinus. So this is the one beautiful point which will be helpful in your ENT. Agree everybody? Getting the point? Okay, sir. Now try to understand. Yes, Shreya, you are right. Rakunai. Now the C is nothing, sir. This is our brain tissue. Agree? Yes, sir. It is our brain tissue. Now, further question for all of you. Can you observe this particular bony structure? Yes, sir. This particular bony structure which is having the shape in such kind of the way. Yes, what is this? So I'm marking for all of you this one as the D. Tell me what is the D. And can you observe there is a one particular lucid structure. Yes. There is a one particular lucid structure. Actually, it is the partition between the two ventricles. I am giving the clue for all of you. What should be the name of this structure? Yes, sir. Again, there is the one structure which you have to identify, which is running like a girdle, belt shaped in this way. What is this? And then you have to say, just below this structure, yellow color line. And another one more point I want to indicate, there is one white color structure, very famous question for the NEET PG student, this one. So I am marking this structure as the D, and this is your E, and here is your F. Agree? So please tell me, try to attempt these things, and yes, don't worry if you are doing mistake, because this platform is to do the mistake, and by learning from this mistake we will not do the mistakes in our UG exams, in our NEET PG, in our INI-CET, in our FMG exam. Getting the point? So you have to say what is this DEF. What is this DEF? Tell me beta. D. So Dr. Neuro is saying D. Yes. Seth Raman, Muralidharan is here. Corpus callosum, very good. Yes, Mishal, fornix, you are saying fornix, but what is a fornix? Yes, falx cerebri. Uday, E is falx cerebri. No beta. This particular fold, white color fold, this is the your falx cerebri. Okay, we are not indicating right now. Sir, this D is our corpus callosum. So remember, the corpus callosum is very important structure. It is the largest band of the white matter, one MCQ. It is example of the commissural fiber, 2 MCQ. Yes, it is having the part rostrum, genu, trunk, isthmus, and then splenium. Okay, sir. And this E is nothing. This is our septa. Yes, sir, that's a septum. And it is lucid. So you will say septum lucidum. Getting the point? It is transparent. ये पतली सी झिल्ली जैसी स्ट्रक्चर होती है, पन्नी जैसी स्ट्रक्चर होती है जो ट्रांसपेरेंट होती है, इसलिए ल्यूसिडम कह रहे हैं. यू कैन से द सेप्टम पेलुसिडम. एग्री? ब्रेक द नेम एंड गेट द आइडिया. आवर यूजुअल funda. Then F. F is nothing. This is our very, very important structure, fornix. Remember, this fornix has been asked. It had been asked in your NEET exam continuously 2019, 20, 21. Yes, as well as INI-CET, I will like to inform. Yes, 22. Every year it is asked. Fornix is very important for the INI-CET and the NEET PG exams. Okay. So now we are creating one mnemonic. लाइफ में बार बार ऐसे ही बस पढ़ते रहना है क्या? कॉन्सेप्ट सीखो, फंडा सीखो, फिर उसका हम कुछ ट्रिक निमोनिक बना देंगे और तुरंत आंसर करेंगे. वी विल सेव द टाइम ड्यूरिंग द एग्जाम हॉल. आवर निमोनिक इज CSF. सो फ्रॉम top to the bottom, C for corpus callosum, S for septum pellucidum, and F for fornix. Agree everyone? Getting the point? Okay, so this is your CSF. Fine, sir. Now just below to this structure, can you observe there is a one more structure, this opening? Yes, inform me beta, what is the name of this opening which is located just below the fornix? Who will tell me about this G? What is this G? So I am looking at the comment box. Try to give the answer. Okay, and if you all are enjoying, just give me any kind of the emojis. Okay, sir. Okay. Thank you, everybody. Thank you. So what I want to tell you, sir. Now this all the brain part just below the fornix. Can you see one mass? Yes, sir. There is a one oval mass. And below to it, can you see there is a one another area? And then can you observe this particular area? So I am going to ask these questions from all of you. You have to answer about this particular zone 1. Then you have to answer about this another area. And then you have to answer about this rounded portion. So I am indicating these structures here. Sir, this one. And this green one, and then here is one another structure. Okay, so just A, B, C, D, E, F, G, then I am indicating as the H, then I, and then J. So comment, please comment what is the G, what is the H, what is the I, and what is the J. Okay, try to catch this point. Sir, there is a one opening, one foramen. Yes, sir. This foramen will connect the two lateral ventricles with the third ventricle. Fine. Sir, this particular area just below the fornix, this particular part is having the zone of the third ventricle. So the lateral ventricle connected with our third ventricle. Yes, the name of this foramen is, remember, the interventricular foramen of Monro. Getting the point, everyone? This is the interventricular foramen of Monro. And this particular part, yes, it is the area of the diencephalon. Diencephalon, which is having the two parts, dorsal part and ventral part. You know, there is our, can you observe? This is the cerebral aqueduct of Sylvius. And then it is connecting the third ventricle with the fourth ventricle, which is tent shaped in structure. And this is the our, yes, central canal part. Getting the point? So remember, you have to draw one imaginary line in between the interventricular foramen of Monro and the our starting part of the cerebral aqueduct of Sylvius. This is known as hypothalamic sulcus. Above this hypothalamic sulcus, yes, this particular part is our dorsal thalamus, dorsal part of the diencephalon, and below to it, this is the ventral part of the diencephalon. Getting the point? What I want to tell you, sir, here above this our line, within the dorsal part of the diencephalon, this particular part is our, yes, thalamus. And below that line, this green color area is indicating the eye. Eye is nothing. It is the hypothalamus. Now after this, you will be able to understand the medicine and your, yes, you can say the physiology also. Fine. So diencephalon, hypothalamus, this, yes, thalamus, hypothalamus, this all are the part of the diencephalon. Now look, the hypothalamus, it will synthesize the two hormones, antidiuretic hormone, MCQ, as well as oxytocin hormone, love hormone, MCQ. And these are released, then stored within this particular zone, J. Can you tell me what is the name of this J? Sir, this J is nothing. This J is our pituitary gland, which is located within the sella turcica. Yes, MCQ. Recently asked question. This sella turcica is also known as Turkish saddle. Yes, sir. So this is also known as our Turkish saddle. Getting the point? So we are going to create the mnemonic again. First time when we are studying, it takes time to make the proper concept. But next time we will not do the mistake, and for the quick answer, we will create the mnemonic. Our first mnemonic was CSF. Yes, sir. Corpus callosum, septum pellucidum, fornix. And then just below to it, there is the our structures TH, and within the Turkish saddle there is our pituitary gland. So I am writing here the pituitary gland. Agree everyone? Yes sir, this is our pituitary gland. So this is our THP. So our mnemonic is THP. Anything you can create. तुम होगे पास. Remember, तुम होगे पास, तुम होगे कामयाब. Otherwise, तुम हमारे पिया. Otherwise, तुम हो पियक्कड़. Any kind of the mnemonic, funny way you can remember to remember this all the sequence. Okay, getting the point? So yes, you are right, Uday Kumar. Okay, so this is our THP. One more classification I want to write for all of you. Sir, there is our diencephalon. Extra age I am giving you. Okay, diencephalon, it is divided into the two different parts. Sir, which structure is dividing? Answer is hypothalamic sulcus, which is passing from the interventricular foramen up to the upper end of the cerebral aqueduct of Sylvius. Okay, sir. Now, there is our dorsal part, and here is, yes, ventral part of the diencephalon. Okay, sir. Dorsal part. Again, it is divided into the thalamus. Another thing you can remember, the metathalamus. And another thing you can remember, that is the epithalamus. Agree everyone? Fine. While the ventral part, look here, the ventral part is divided into the ventral, it is below. So you can say, sir, it is having the hypothalamus. Yes, sir. Another thing, that is our subthalamic nuclei of the Lewis. Okay. Yes. When there is a lesion in the subthalamic nucleus of the Lewis, then there is the projectile throwing movement from half of the body, that is known as, yes, hemibellismus. NEET PG 2021 and 22 question. Fine. Few more extra age I want to give for all of you. Sir, this metathalamus. Sir, metathalamus is equal to lateral geniculate body plus medial geniculate body. So this is the one important equation. Yes, integrating with your medicine, with your ENT. Remember the lateral geniculate body. Sir, this lateral geniculate body is related with the which pathway? Vision pathway, MCQ. While the medial geniculate body is related with the which pathway? Auditory pathway. So these are your, yes, you can say the ophthalmology, ENT, physiology, medicine, integration. Agree everyone? Fine. Yes, you must know this epithalamus. This epithalamus is nothing. I am writing here the epithalamus is equal to our pineal gland, which is considered as third eye of the Lord Shiva, plus, yes, habenula. So this is the one another important equation for all of you. So remember these points. These are very important facts for your INI-CET NEET PG exam. We will talk about this third eye of the Lord Shiva, pineal gland, and the habenula in our different session. But right now we are going to talk about the cadaveric image. Sir, hypothalamus is the center for control of the visceral activity and this subthalamic nucleus of the Lewis. Yes, if there is the damage, there is a projectile throwing movement, ballistic movement in half of the body, hemibellismus. So this is the question from the your NEET PG 2021 and 22 continuously repeated. Very important. So this is the extra age for all of you, the diencephalon. So you can take the screenshot for this all the facts. Agree everybody? Getting the point? Okay? Okay, sir. Now look here further. Done. So we understood this all the sequence. CSF, C for corpus callosum, septum pellucidum and fornix. Then THP, tum hoge pass. T for thalamus, H for hypothalamus, then P for pituitary gland. These are in sequence. Now, can you see these structures, sir? These structures are located over this particular part of the central nervous system, which is getting elongated on the downside. Agree everyone? Fine. So what should be the name of this structure? I am just putting the black color margin. Yes. Tell me. Tell me. What should be the name of this structure? Yes, sir. This are MPM. I am putting the name MPM. What are this MPM? Sir, this M is our, yes, otherwise next sequence. My question is up to the J. Then I am putting here the KLM. What is the K? You have to answer. What is the L? You have to answer. And what is the M? And then you have to answer about this structure N. Okay. So here I am putting the arrow K L M N. Okay. So tell me what is this K? Very nice, Simran. You are saying brainstem. Yes, Uday, you are right. Brainstem. Simran, you are right. Medulla, pons, and the midbrain. So K is nothing. I am putting the one another mnemonic MPM. M for, sir, M for midbrain. So in exam, such kind of cadaveric images will be asked. Such kind of the your spotters will be asked. P for, remember the pons. This is the question from the your FMG exam 2022 radiology integration. Okay, they put the image on the basis of the radiology, and this M is nothing. This is our medulla oblongata. Yes, they ask about this fern tree like branching pattern. Yes. Tell me what is this fern tree like branching pattern? Sir, this is nothing. This is our cerebellum. Yes, sir, it is our cerebellum. Okay, so this cerebellum had been asked in your all India, you can say the NEET exam, but 2019. Okay, so these all are your MCQs. These all had been asked on the basis of the radiology, not the anatomy image was given, but at the platform of the anatomy, with the knowledge of the anatomy, you can solve that radiology question also. Okay, beta, getting the point? Yes. My favorite academy is Cerebellum Academy. Yes, you are right. Now look after this all. Sir, the continuation of this medulla oblongata. Yes, can you see on the downside? This is within this box-like structure. These box-like structures are nothing. These are our vertebra. So within the vertebral column, what structure is there? The continuation of the brainstem. This is nothing. This is our spinal cord. Yes, sir. It is our spinal cord. Agree everyone? Getting the point? Okay? Yes. Now catch these things further. These are our ventricles. Yes, over the thalamus hypothalamus here is a third ventricle, and the continuation of this third ventricle, very narrow passage, you can observe here, this is the cerebral aqueduct of Sylvius, then this is the fourth ventricle, and then here is our central canal part. So just few extra points, can you see, just behind the our midbrain, yes sir, this is our midbrain, can you see one elevation and another elevation, and just above this elevation one mass is located. So I am going to ask from all of you, what is this structure area? Yes, I am putting the name O, then you have to answer about this one and another elevation P and this Q. So can you tell me what is this OPQ? Okay, so very small elevation, the elevation just behind the midbrain. Then we are going to talk about our ophthalmology integration. Yes, tell me better, tell me, hope you all are enjoying. So just tell me, what are our different structures at this area? Yes, tell me anyone. Then also you have to help me to identify, these are the MCQs now, first box, second box, third box, fourth, fifth, sixth, seventh, so on. Yes, within which the spinal cord is running. Hope you all are able to understand this all the things very easily. This is the first cervical vertebra C1, then second word cervical vertebra C2, then C3, C4, C5, C6, C7, and this is not the C8, this is the T1. Yes, C8 is the cervical nerve, but this is our T1 thoracic vertebra. Okay, getting the point? Very nice, Shreya, Anil, not peduncle, it is the colliculi. Okay, it is the colliculi. Very good. Pineal gland, Medbix, Simran, you all are giving the excellent answer. So O is nothing, it is the our third eye of the Shiva, pineal gland, you are right. And then P is the our elevation just behind the midbrain, there is our colliculi. So this is above, that's why you will say superior colliculus, and this is nothing, this is our inferior colliculus. Getting the point? So now you can see, sir, the pineal gland is located just above the superior colliculus. Ophthalmology integration, within the our superior colliculus there is the location of interstitial nucleus of Kahal. Yes, it is written in Hindi as the Kajal, but remember it is the Kahal nucleus. Pronunciation is the Kahal. You know, yes, this is the very important point. This interstitial nucleus of the Kahal and superior colliculi, these are responsible for the our upward gaze. They help us to look upside. So this is your ophthalmology conceptual brainstorming integration. Now I will teach you later, sir, whenever there is the tumor in the pineal gland, pinealoma, then it will compress the our superior colliculus. This will cause damage to the interstitial nucleus of the Kahal, and it will result into the loss of upward gaze. Yes, sir. If there is damage in this structure, then there is a loss of upward gaze. So the patient will present with the what? Sir, the patient will present with the downward gaze. Getting the point? One patient is coming with the downward gaze. This is your Harrison integration. So this downward gaze is nothing, sir. It is our doll's eye sign, which is also known as the oculocephalic reflex. Yes, sir. This is nothing. This pineal gland tumor is our, yes, you can say the Perinaud syndrome. So this is the beautiful your extra age point. I am writing one short notes for all of you, sir. Pineal gland tumor. Okay, sir. It is known as definitely the pinealoma. Okay, sir. It is causing compression damage at the posterior part of what, sir? Midbrain. Fine, sir. So the patient is presenting with the our downward gaze due to the damage to the interstitial nucleus of the Cajal. Yes, I am writing here superior colliculus damage, interstitial nucleus of Cajal damage. So the patient is presenting with the loss of upward gaze. Patient is presenting with the downward gaze. That is a doll's eye sign. This situation is known as Perry Knots syndrome. So this is the very beautiful integration of the anatomy with your Harrison, with your medicine. Getting the point, everyone? Yes, sir. So this is the beautiful your notes, and you can remember one mnemonic: P. 4P you have to remember. Okay. So this is the point. Yes. So this is the point which you have to remember. In this situation, the 4P is your SKV mnemonic, SKV magic, you can remember. Okay, fine. So you must know these 4P. Agree, everyone? Getting the point? Okay. Yes. So Perry-Knots syndrome, you will see in the Perry-Knots syndrome, it is located at the superior colliculus level, and at the level of the superior colliculus, which cranial nerve is located? Sir, third cranial nerve is located. So definitely the third cranial nerve will be answer. Yes, if there is a damage at the inferior colliculus level, then which cranial nerve will be affected? Sir, fourth cranial nerve. Getting the point? So you will see in your medicine part, this is the beautiful integration with that facts. Okay, so this is our extra edge. Yes, dolls are you. Yes, Anil, see here. जब छोटे थे गुड़िया से खेलते थे, गुड़िया खड़ी रहती थी, उसकी आंखें खुली रहती थी, जैसे ही हम गुड़िया को लिटाते थे उसकी आंखें बंद हो जाती थी. So the patient is presenting with the downward gaze. This is known as the doll's eye sign. Agree everybody? Getting the point? No, it is not the ptosis, it is the downward gauge. Yes, it is above the level of the first MBBS. We are talking about our Harrison medicine. Yes, I am teaching all the 19 subjects since the 2009. Okay, integration तो अभी आया है, next pattern तो अभी आया है. I am teaching since 2009. I was getting the ortho and the pedia, but I left them and opted the anatomy just to teach all the medical subjects to the students, and doing the same from the hours since 2009. Okay, so that is giving benefit to all our students at this portion in our next platform. Okay, fine. Okay, sir. Now what I want to tell you, sir, after these facts, can you tell me, sir, if these are your spinal cord and the vertebra? Yes, sir, it is our vertebra. So just in front of the vertebra, can you see this narrow passage? Yes, sir, this narrow passage is nothing. This is our esophagus. And just in front of the esophagus, you will see one another, our, yes, wide structure. This is the passage for the air. It is nothing. It is our trachea. Remember the V for vertebra. Remember O for esophagus, and T for, remember, this is our trachea. Agree, everyone? Getting the point? Fine. Yes, Simran, we will talk about the cranial nerve nuclei in our different parts. Okay. Yes, at the level of superior colliculus RM, there is a third cranial nerve, and at the level of the inferior colliculus, there is a fourth cranial nerve. This is the point. Getting the point? Okay, sir. Now try to understand further. Yes, look here, our mnemonic is VOT. So what are the formula? Till now we had seen the sequence CSF, corpus callosum, septum pellucidum, and the fornix. Then we had seen the formula. Yes, THP, tum hamari piya, thalamus, hypothalamus, pituitary. Just below to it there is the our MPM. Yes, midbrain, pons, and then medulla. And then we had learned the VOT. Do you know? Earlier, the great leaders of the India, they were saying, तुम मुझे खून दो मैं तुम्हें आजादी दूंगा. But nowadays the great leaders, they are saying, तुम मुझे वोट दो मैं तुम्हें बर्बादी दूंगा. So remember this funny thing, VOT, vote. Okay, now we are going to integrate with our surgery, with our medicine. Yes, see here, if this is the esophagus, then the upper part of the esophagus, it is getting dilated, it is getting spreaded, funnel like spread. Can you see this portion? So this upper funnel like dilated part, which is open anteriorly, sir, it is nothing. This is our what? This is our, yes, pharynx. Remember the upper dilated part of the esophagus. I am marking from here, it is getting dilated. Yes, funnel like dilatation is present. So you can observe this portion. Correct, sir? You can observe this portion, the continuity, and you can observe this another portion. Getting the point? Okay. So this is nothing. This is the pharynx. Again, you know the pharynx is having the three part: nasopharynx, oropharynx, laryngopharynx. You can easily catch these points. Sir, this is the our nose part. So just behind to it, this is the nasopharynx. And here you can see the upper lip and the lower lip. So this is the our oral cavity. Just behind to it, oropharynx. And this particular part is our larynx. So behind to it, laryngopharynx. Agree? What I want to tell you, the three parts of the our pharynx you can see: the nasopharynx, the oropharynx, this is laryngopharynx. Agree everyone? Getting the point? Fine. So now we are going to enter in our ENT. Okay. What you have to remember? Actually, the exam pattern has been changed. They are putting such kind of the cadaveric image. Sir, it is bad? No, it is good. Why? Because when we are going to do surgery, we will see such kind of the things. We will not see the linear diagram. So you must learn this kind of the situation to make easier your future life. Okay, and it is easy. They are not asking the theory part. They are not asking the different verbal things. They are asking the images which you see during the operation. So it is good. It is relevant. Okay, what I want to tell you, sir, these are the our parts of the pharynx. Now the ENT integration. Can you tell me the different relation of the our nasopharynx, oropharynx, laryngopharynx? See here. जो दिख रहा है वो बोलना है. Sir, we are going to learn the anterior relation, superior relation, inferior relation, posterior relation. Then you have to say about the relation of the oropharynx. ENT, I am talking about the ENT as well as you can say the endoscopic. Yes, oesophagoskopic, pharyngoscopy. So esophagus, superior relation, inferior relation, anterior relation, posterior relation. Then you have to say about the laryngopharynx, superior, inferior, then anterior and the posterior relation. Now it is very easy. Anatomy means काटो और देखो, cut and observe. So your observation should be strong. And it is very easy. Can you see? Nasopharynx. Sir, superiorly it is related with the base of the skull. Correct, sir? Inferiorly, what is the relation? This particular structure. This particular part is just behind the oral cavity. So this is our oropharynx. Nasopharynx is behind the nasal cavity. And the laryngopharynx is behind the our larynx. Yes. So the inferior relation of the nasopharynx, oropharynx. Can you tell me what is the anterior relation of the nasopharynx? अरे भाई, नेजल कैविटी के पीछे जो है वो नेजोफेरिंक्स है, तो नेजोफेरिंक्स के आगे क्या होगा? सर, नेजल कैविटी होगा. एवरीवन गेटिंग द पॉइंट? इट इज वेरी इजी. Now the most difficult part of the ENT, the posterior relation. Can you see? The nasopharynx posteriorly related with the first cervical vertebra. Yes. Do you remember when we were learning the branches of the axillary artery? We had seen, yes, what we had seen? The branches of the axillary artery. Axillary artery was having the first part, second part, third part. Yes, first part, one branch, second part, two branches, third part, three branches. Do you remember? In the similar way, the first part of the our pharynx, first cervical vertebra, second part of the pharynx, next second cervical vertebra, and the third part of the our pharynx, next three cervical vertebra. Very easy. Yes, anatomy is looking just looking like a wow, so elegant, so beautiful, just looking like a wow. Remember this point? It is very easy. In ENT you will find very difficult, but anatomy is making very easy. First part of the pharynx, one cervical vertebra, next part of the cervical our pharynx, two cervical vertebra, third part is having the three cervical vertebra. So you can see the pharynx is ending at which level? C6 level. So this is your very important question. The pharynx ends at which level? Answer is C6. Now this pharynx is continued as the esophagus. So your MCQ, the esophagus starts at which point? Answer is C6. Yes, you can see this part where the pharynx is continuing as the esophagus. This part is very narrow. This is the narrowest part of the GIT. This is the cricopharyngeal junction. So you can say the cricopharyngeal junction is located at which vertebral level? Answer is C6. Also you can see in front of this laryngopharynx, this particular part is our larynx. So this larynx is ending at which level? Again answer is C6. And then you can say the trachea. Yes, larynx is continuing as the trachea. So trachea is starting at which level? Again answer is C6. What is your concept? सबका मालिक एक है C6. Every fact is having the answer C6. So I am going to tell you the magic of the 6C6. So hope you all are getting the point. First I am going to write down this all the facts. Can you tell me oropharynx relation? Superior nasopharynx, inferior laryngopharynx, anterior. Sir, this is the our yes oral cavity, oropharynx oral cavity, and posteriorly C2 C3 vertebra. Can you tell me the laryngopharynx relation? Sir, superiorly the oropharynx. Sir, inferiorly the esophagus. Sir, anteriorly this is nothing. This is our larynx, and posteriorly, sir, it is the third part. So you can say the next three cervical vertebra. Getting the point? Okay. Yes, Chaitanya. Just looking like a wow. Hope you all are enjoying. Okay. Fine. So what I want to tell you, I'm going to write down this all the facts for all of you. Again, in this slide. Fine. So what I taught you, sir, pharynx. Pharynx is nothing. It is the upper dilated part of our esophagus. We all know the pharynx is divided into the three parts. First part nasopharynx, second part oropharynx, third part laryngopharynx. Nasopharynx just behind our nose, nasal cavity. Oropharynx behind our oral cavity. Laryngopharynx just behind the larynx. Okay, sir. Now I am going to write down the relations. So in a very easy way, we are going to show. This is the notes for all of you. Okay. So I am showing this relation here. We are going to write down the relation of the nasopharynx. I am writing in vertical way. Then we have to know the relation of the oropharynx. And then we have to know the relation of the laryngopharynx. Okay. So tell me the answers. Yes, you have to tell the anterior relation, posterior relation, superior and inferior. Yes, just same notes. We are making the notes for your university exams, for your INI-CET, NEET PG, all the things for your ENT, for your medicine, for your surgery, for your anatomy. Yes, oropharynx, the superior relation, inferior relation, anterior relation and posterior relation. At one part I am showing these facts, sir. Anterior, posterior, sir, superior and inferior. Let's start. Okay. Yes, thank you Dr. Neuro. Thank you for saying got. Okay. What you have to remember, the nasopharynx. Again revising, sir, the nasopharynx, superior relation, base of the skull. Agree, sir? Inferior relation, oropharynx. Agree, sir? Anterior relation, nasal cavity. Posterior relation, first part, first cervical vertebra, C1. Also little part of the base of the skull is coming down. So just write down these facts in your notes. Don't forget it for your, especially for the ENT. Sir, superiorly there is base of skull. Agree? Sir, inferiorly there is the oropharynx. Fine, sir. Anteriorly there is the our what? Nasal cavity. And posteriorly there is the our first part, first cervical vertebra. Most difficult thing to remember the vertebral level, and we are making the most easiest thing. Yes, remember, लप्पू सा एग्जाम है, झिंगूर जैसे कॉन्सेप्ट है, ऐसे ही क्रैक कर देंगे. कुछ रखा थोड़ी यार ये सभी चीजों में. चलो आगे बढ़ो. फाइन. What I told you, yes, the base of skull is also encroaching up to this your posterior part. Khatam, tata, bye bye, gaya. MCQ. Now, can you tell me the relation for the oropharynx? Yes, Devendra, best. hello beta, kaise ho? So try to understand the oropharynx. Again, look for the image, do the imagination. Sir, this is your oropharynx. So there is the relation, superior relation, nasopharynx, inferior relation, the laryngopharynx, the anterior relation, the oral cavity. अरे तभी तो oropharynx कह रहे हो. Getting the point? The oropharynx is nothing. It is just behind our oral cavity. And the posterior relation, remember the C2, C3 vertebra. So beautiful, so elegant, just looking like a wow. Okay, getting the point? Okay, okay, sir. Okay, now we are. Yes, Devendra Bishti, thank you, beta. You are biggest fan. I am also fan for all of you students. I am also very big fan for all of you students. When you are commenting such kind of the things, then I am getting the energy. So you are my fan. I am your AC. Okay. So now what you have to remember, sir, the relation oropharynx. Again, mention in your notes, beta. Sir, oropharynx superiorly relation, yes, nasopharynx, inferiorly laryngopharynx, anteriorly oral cavity, very easy. Only the problem is with the our posterior relation, ENT MCQ. Sir, it is the second part. So it is related with the our next two cervical vertebra. C1 was there. So here definitely the number for the our C2 and C3. MCQ for the your, yes, we are doing this beautiful integration for the ENT, for the medicine. You are looking this all the shadows in the radiology. Yes, we are solving this all the question with the our anatomy. Conceptual brainstorming integration is here. Agree, beta? Fine. Yes. Thank you, RM. Thank you, beta. Okay. Now try to understand. Yes, you can get the PDF of this all the session at the Cerebellum Academy platform in the app, beta. Okay. Now what I want to tell you, sir, these are the facts. After that, we are going to look for the relation of the laryngopharynx. See here, beta. Laryngopharynx. Sir, laryngopharynx. Can you see the laryngopharynx, beta? Sir, this laryngopharynx. Okay. Superiorly, it is related with the oropharynx. Inferiorly, it is related with this narrow passage. What is this narrow passage? Sir, it is our esophagus. Sir, it is our esophagus. Anteriorly, it is related with the, can you see, beta? This is our larynx. And posteriorly, remember, it is our third part. So it is related with the next three cervical vertebra, means C4, C5, C6. We completed the C1, we completed the C2 and C3, and C4, C5, C6. Agree, beta? Fine. So these are the points which you have to remember. Now again, making the notes for all of you. Laryngopharynx, sir, superiorly it is related with the our oropharynx. Agree, sir? Inferiorly, it is related with the esophagus. Agree, sir? Anteriorly, it is related with what, sir? It is related with the larynx. And posteriorly, it is related with which structure? Sir, posteriorly, it is related with the our next three cervical vertebra, means C4, C5, C6. Sir, the ENT MCQ. So this is the your ENT CBI, conceptual brainstorming integration we are doing. Fine. So these are the points easily you can remember. So very important fact for all of you. I am making the box. Don't forget this questions. These are very important fact. Okay. The relation of the nasopharynx, oropharynx, and then laryngopharynx. Done, sir? Now try to understand further. Yes, sir. We are looking for the next. Can you see? Just in front of the esophagus, sir, there is a trachea, and the upper part of the trachea, that is a larynx. Yes, sir. This is our larynx, where you can see the leaf-like structure is protruding. Sir, this is nothing. This is our epiglottis. Yes, sir, it is our epiglottis area. Can you see here within it there is the vestibular cavity? Yes, sir. And then here you can see the our Adam's apple portion, as well as the lower part where there is the location of the our cricoid cartilage. Means this entire part is indicating the our larynx. Yes. So this is our what? This is our, yes, you can say the larynx. This is the our larynx. Okay, sir. So definitely this marked structure is epiglottis. Agree? So this was asked in your FMG exam. Very simple question, but cadaveric image, it was creating the problem. Agree, beta? Now look, this epiglottis is located at which vertebral? Yes, you will see this is located at the our C3 vertebral level and it is ending at which level? C6. So this is the your very important question. Remember, the larynx is extending between the C3 to C6. MCQ beta. Very important fact. Okay. Now you can see the epiglottis is located at which vertebral level? C3. Now the Adam's apple, the FMG 2018 question, Adam's apple is created by the our thyroid cartilage. Yes, the upper border of the thyroid cartilage, it is located at the C3-C4 junction. So what I want to tell you, at this C3-C4 junction, remember the upper border of thyroid cartilage, C3 C4 junction. This is the another recent MCQ in the 2021-22 FMG exam. Okay. Now the NEET PG question. Can you see where the larynx is ending? At the level of the C6. Where the trachea is starting? Where larynx ending? There trachea is starting. Why? Because yes, larynx continues as the trachea. In the similar way, where the pharynx is ending, there esophagus is starting. So remember beta, what you have to remember? Sir, the ending of the our pharynx, where? C6. So the starting of the esophagus, again C6. And you can observe this part. This is the very narrow. Yes, this is nothing. This is the narrowest part of the GIT, the cricopharyngeal junction. So I am going to write down the magic of the six, the magic of the six. Okay, so one more important fact for all of you, then we are going to integrate with the radiology. Okay, sir. So try to understand, sir. There is our structure. Yes, magic of six. ये सबका मालिक एक है, कौन? C6. What you have to remember, sir? This is your question. That first point. What? Our pharynx ends at. Answer is C6. Yes. Second, our esophagus starts. Definitely, where the pharynx ends, there esophagus starts. So the esophagus is starting at C6. MCQ. Next, third MCQ, where the larynx ends at. Again, answer is C6. And then where the trachea starts, where the larynx is ending, there trachea is starting. Getting the point? Yes. Again, answer is C6. Now, which is the narrowest part of the GIT? MCQ, sir, the narrowest part of the GIT. Your clinical question, surgery, medicine, ENT question. Yes, the of GIT, that is our cricopharyngeal junction. Sir, it is located at which vertebral level? Again, C for cricopharyngeal junction. Just turn this one, so it is turning into the 6. So this is the another way to remember, C6. Okay. And one recent FMG January 2024 question, you must remember, sir, the common carotid artery is palpable at which level? Again C6. And this C6 we had seen in the cadaveric image. Sir, it is the level of the cricoid cartilage. Yes. We all know, yes, again the cricoid cartilage at the level of the C6. So you have to remember the magic of six facts. You have to remember these all are your questions from the ENT, surgery, medicine, radio, anatomy. So this is the beautiful integration. Anatomy is just looking like a wow. Yes, so elegant, so beautiful, just looking like a wow. Okay, hope you will never forget this formula. This very important question. Agree everyone? Fine. If you all are liking these things, just send me the different kind of the emojis. Hope you all are enjoying this session. Fine. Okay. Yes. So try to understand further fact. Okay. Look here. After this all, this is the point I am making in large for the proper notes. Yes, sir. These are the points. Now look for these things. Okay, sir. So these are the different facts. Now look, one important knowledge. Gray's anatomy and your clinical. Sir, this is the word junction between the cricoid cartilage. Also, you can say the pharynx. This is the cricoid and this is the pharynx. So this is the cricopharyngeal junction. It is the narrowest part of the GIT. But I want to tell you the our narrowest part of the GIT. Okay, sir. Remember the cricopharyngeal junction. It is 1.5 millimeter. But the Gray's anatomy is saying that the vermi form appendix, it is 1 millimeter. So now what you will opt? So this is the one great controversy. I am going to solve this controversy for all of you. MCQ and MCQ. So who is narrower? Definitely the vermiform appendix is more narrower than cricopharyngeal junction. But remember, this vermiform appendix, it is not considered as part of GIT. Okay? Yes, physiologically means you can say functionally as well as clinically. Getting the point? Yes, anatomically it is considered as the part of the GIT. Anatomy means structure. But functionally, when we are eating the food is not getting enter in the vermiform appendix. You are right. And clinically, when you are doing the endoscopy, colonoscopy, at that time endoscope, colonoscope, it is not entering into the our vermiform appendix. So remember, clinically as well as physiologically, it is not considered as a part of the GIT. So which one is narrowest part of the GIT? So remember, clinically and physiologically, this is narrowest part of GIT. I am writing here. Clinically means in your ENT, in your surgery, and in your medicine. Okay. Also functionally means physiology. But the narrowest part of the GIT, anatomically, structurally, you can say the vermiform appendix. And whenever there is a controversy, always go for the clinical answer, because you are not going to be the doctor of the dead body, you are going to be the doctor of the living person. So clinical answers are better. What I want to tell you, I am removing all your controversy, sir. Clinical answers are better than physiological answer, and physiological answers are better than anatomical answer. Remember, anatomy is base, it is always hidden. Okay, it is not the matter for the fighting in between the clinician and the anatomist. It is the matter for your selection. So I am the anatomist, but I am telling you, prefer the clinical answer first, then function is more important than structure. Getting the point? So function is your second answer. And if these are not opted, or especially they are giving the any image, cadaveric image, they are asking for the anatomical answer, then go for the anatomy. Okay, this is the question for your career. Okay, so this is the correct sequence for the your answer of the controversial question. Agree everyone? Controversial question. Okay, so these are the answers. Agree everybody? Hope you are getting the point. So now we are going to look for the more things. Okay, sir. So these are the different points. Now look further. About this portion, sir, this is our epiglottis. Can you see? There is our mandible. Okay, sir. And just behind the mandible, can you see the one elevation and one another elevation? These are the genian tubercle. Okay. And here you can see the tongue. Remember, one muscle is taking origin from the our genian tubercle, superior genian tubercle, and spreading in the our tongue. This is nothing. This is the our genioglossus muscle. What is the name of this muscle, sir? This is our GG muscle. Giving respect to this muscle, very important, sir. This is our which part? This is our mandible. Okay, what you have to remember, sir? This is our muscle genioglossus. We will talk in our portion of the tongue. Give respect to this genioglossus. Yes, that's why you have to use the term GG. Okay, this genioglossus muscle, remember, it is responsible for the protrusion of the tongue when it will contract. Do you remember I told you jidhar muscle udhar movement? When it will contract, it will protrude and it will prevent backward falling of the tongue over the trachea. Yes. So remember, it is preventing the backward falling of the tongue over the trachea. So it prevents choking. So that's why it is known as, another very important question, safety muscle of tongue. Now, one question for all of you, which muscle is known as safety muscle of not tongue? I am asking the larynx. So tell me the answer. These all points are your very important MCQs. Safety muscle of the larynx you have to answer. Okay. Now, can you see this tongue is located within the oral cavity? So you can easily catch, sir, this is the our upper lip. Here is the our lower lip, and this is definitely the oral cavity. Okay, sir. Can you see there is our hard palate and there is a soft structure which is hanging backside? Sir, this is our soft palate. So you can say, sir, this portion is our, yes, hard palate and this is the soft palate. Getting the point? Now, just above to it, there is our nasal cavity. Okay. So this is our nasal cavity part. Yes, just behind the nose. Partition between the nasal cavity and the oral cavity, that is nothing, that is the our, yes, you can say the hard palate, and behind to this there is our soft palate. Okay, so these are the points. Now going to integrate this all the things in our next class. We will see the integration of this anatomy with the radiology, where I will tell you this basic principle, the banana memes, and then I will tell you the same thing just in short sweet integration. Can you say the same thing? Sir, this is our, yes, in tomorrow class we will discuss now. This is our what, sir? This is the our same thing, scalp, and then you will see the skull bone. Yes, similar, just similar. We had seen the your scalp, then skull bone, then CSF, corpus callosum, septum pallidum, and the fornix. Yes, then we had seen the THP, thalamus, hypothalamus pituitary gland. Then we had seen the our MPM, midbrain, pons, and then medulla, and then behind it there is cerebellum. Then we had seen the spinal cord, then VOT, vertebra, esophagus, and trachea, then our pharynx, larynx. So in tomorrow class we will discuss about this all the things. Just one quick revision, sir. Scalp, so you can say, sir, this is the our what, brain. And can you observe, just compare with this anatomy? In tomorrow session we will see this is the our what, sir? This is the our corpus callosum, sir. This is the our C. Just below the corpus callosum, the black color structure is showing the septum pallidum, S. And can you observe there's a one small structure which is encroaching on the front? So this is the our F. Yes, these are the corpus callosum, septum pallidum, and our fornix. Then I told you there is our T, then H, and then P. Sir, these structures are thalamus, and then hypothalamus, and then pituitary. Sir, these are our thalamus, then hypothalamus, and then yes, pituitary gland. THP is your formula. Then I told you the formula, sir, MPM. Yes, these are our midbrain, and then pons, and then medulla. Yes, your radiology will be very easy if your anatomy is strong. Radiology is nothing, it is the shadow of the anatomy. Just behind the midbrain, I told you the elevation. This is the above elevation and then below elevation. And this particular area just above this elevation, that is nothing. This is our pineal gland. What I want to tell you, sir, this is our third eye of the Lord Shiva, pineal gland. This first elevation is superior colliculus, then there is the our yes inferior colliculus. This fern tree like branching pattern, this is nothing, this is the cerebellum. Yes sir, it is our balancing organ, cerebellum. Getting the point? And then continuation of that medulla oblongata I will tell you in the next class. Yes, this is our spinal cord. So if this is the spinal cord, in front of the spinal cord you will see there is the vertebra, and then you will see the our esophagus. Yes, that is converting to the pharynx, and this is the our larynx part. This particular part which is hanging upside, sir, this is larynx. Okay, you can say the upper part of the larynx, that is better to say epiglottis. Just we are comparing with the anatomy. Can you see? We will see in next class this radiology part, but just I am integrating now. Can you observe this is our mandible part? Yes, this is our tongue. So here is our genioglossus muscle, safety muscle of the tongue. And can you see this is oral cavity? So the partition, yes, above this is the nose, the cavity of the nose, definitely the nasal cavity. So the partition between the nasal cavity and the oral cavity, it is known as hard palate. Yes, indicating with the HP, and the hanging part behind the hard palate, this is our soft palate portion. Getting the point? Yes. So this is our beautiful integration of the anatomy with the radiology. In our next session, we will go for the radiology on the basis of the anatomy. So hope you all enjoyed this session. So at the last, remember, passion and consistency is equal to success. Yes, there are the lots of the people in the world who are talented, who are hard worker. Yes, who are always motivated. But remember, if you are having the passion, and if you are having the regularity, consistency, then you can break that brilliant person also, that hard worker person also, with the help of this simple rule. So thank you very much. God bless you all. सिर्फ हंगामा खड़ा करना हमारा मकसद नहीं, कोशिश है कि सूरत बदलनी चाहिए, हमारे सीने में नहीं तो तुम्हारे सीने में ही सही, कहीं भी हो आग, लेकिन ये आग जलनी चाहिए, ये आग जलनी चाहिए, ये आग जलनी चाहिए. Thank you very much. Please ask if any doubt. Yes, any doubt beta, please ask. We will continue this session with our radiology integration in our upcoming days. Na? Hope you all enjoyed the session. Yes, hope you all enjoyed the session. Chaitanya, Prajwala, Shreya, Hari, D&D channel. Yes, Devendra. Thank you, Dr. Neuro, Dr. Anil. Okay, don't forget to follow me at the Insta and the YouTube channel, Dr. Shrikant Verma Classes. You will see the many integration, many useful materials at these our channels. And any kind of a doubt, okay, not tomorrow, we will take the class the day after tomorrow. Okay, beta. Okay, so thank you very much. God bless you all the best. We will meet soon. Thank you, take care, bye bye. So at the last, yes, I'm just showing one magic every session, one little magic is there. So just one magic for all of you. Okay, so these magics will show how the anatomist can do anything. Okay, so one little magic, abracadabra, gili gili, choo.